Good afternoon, everyone. On behalf of the Medtronic, I'd like to thank the European Board for allowing us for this opportunity to speak. I do have a declaration to make. Free agency is indeed ruining baseball in America, but for the Americans in the audience, you guys will understand what I mean. I'd just like to touch very quickly. I've got 5 minutes here. Certainly Medtronic, one of the reasons why I really like this slide is that Medtronic is a company that's very focused on R&D. This is a slide that we use in a lot of corporate presentations, but $1.6 billion that we spend in R&D for internal product development, as well as working with companies like the one I'm going to tell you about in a minute. It's these kinds of investments that allow us, not just within Medtronic, to bring the kind of technology that we need here in the market within perfusion internally, but also through partnership and through external innovation. Medtronic as a company is very present in all the markets, and I think that's our biggest advantage, to be honest, that allows us to work with you in a more one-on-one way. You're always working with someone that is directly from Medtronic, not necessarily through someone that is not representing our company. But that also allows us the reach to be able to hear what you guys need and to allow us to develop the products that you need and to partner with companies. That ultimately what that means is that for every 2 seconds that goes by within some part of Medtronic, there's one of the products positively affecting a patient or being used in a therapy somewhere in the world. Now, we also have a legacy of partnerships, not through our own internal development and internal product research and development, but a lot of what we have been doing is not only done internally, it's being done externally. And one of these partners, I would strongly encourage you to come and see during the exhibition hours that starts tomorrow night. In booth 121, we are launching a new perfusion station that includes an option for a heart-lung machine, includes an option for patient monitoring. It's a modular system. Strongly encourage you to come to the booth. It's a cooperative partnership between Medtronic and Spectrum Medical. Spectrum Medical has developed the technology, and we're representing them commercially. And I'm very pleased to announce that we have extended our commercial agreement yet again. We're very happy with the partnership. They're an exceptional technology company, and we're very excited by the products, not just that we're showing here at EACTS, but some of the technology that's going to be coming in the coming years that they're also developing. Now, obviously, that same partnership extends to companies like MC3, which is a joint venture company that Medtronic is also teaming with. MC3 is a research and development company and a production company that leverages a lot of the technology that was developed originally by Avalon, as well as the partnership between industry, research and development, and clinical expertise in the area of ECLS and ECMO. We will be launching their cannula, which is a relaunch of the SoftFlow, the original SoftFlow cannula, but manufactured more to a different and a higher standard that we would need to be able to bring this kind of a product into our portfolio. And obviously, with this addition to our cannula family that we've already launched last year at the same time, the femoral cannula, entirely new generation across arterial, venous, pediatric, and adult, as well as we're now entering the 5th year of clinical use of the Affinity Oxygenation System that's been used on at least well over 500,000 patients to date. So I'd like to close here just by also reminding you guys that our commitment is not just in research and development, product development, meeting customer needs, but also in continuous education. We do offer the flow physiology course. We've revamped our education center based in Kerkrade, where we make our custom sets, and we have academia courses on mini bypass with 3 different institutions, including Bern, Braunschweig, as well as the American Hospital in Thessaloniki. And we are also continuing to support our academic course in Leuven, and we're working with RIGS in Copenhagen as well to develop a course that's more based on patient monitoring, the benefits of non-invasive patient monitoring, as well as advanced oxygenation. And with that, I'd like to thank you all for your attention, and hopefully I didn't go over 5 minutes. Perfect. Excellent. Thank you.